Good afternoon. I'm Karen Engel, and I teach at the law school, and I co-direct with Professor Neville Hode here in the English department, the Bernard and Audrey Rapoport Center for Human Rights and Justice. Welcome to our event today on COVID-19, structural inequality, and the future of low-income Latinx construction workers in Austin. This is a collaborative event to discuss a collaboratively generated report. So I welcome you on behalf not only of the Rapoport Center, but the Dell Medical School and the Workers' Defense Project, who contributed importantly to the report we will discuss, as well as on behalf of the Vice President for Research at UT, which is supporting a larger project on the future of work, of which many of us are involved with, and the Opportunity Forum at UT, which has done important work on many of the issues we're discussing. I want to thank Heather Way for the co-sponsorship of the Opportunity Forum, Dr. Michael Pignoni, the interim chair of the Department of Population Health at Del Med, for his enthusiastic support of the webinar. And I also want to thank Bridget Keenan, the administrative manager of the Department of Population Health, and Sarah Eliason, the assistant director of the Rapoport Center, who have coordinated the logistics of the webinar. We have an incredible group of audience members here from all over UT, including but not only the Law and Medical School. We have people from other universities around the country as well. We have City of Austin and Travis County employees and some employees of neighboring counties. We have a number of representatives of community and advocacy organizations, as well as quite a few people from architecture and construction firms and companies. This is a conversation we all need to have together. So thank you for being here. Now, everyone on this webinar stage is involved in or has influenced the report we're going to talk about in some way, whether they know it or not, and whether or not they agree to all of it. But I think you'll see their influence as we go along. So our plan for the session today, Neville and I will tell you a bit about the background of the report that the Rapoport Center published in November, and just give you a very brief summary of the findings. We'll then ask our respondents, Council Member Greg Kassar, Dr. Jewel Mullen, and Emily Tim of the Workers' Defense Project to offer a round of comments on the report, followed by responses from the report's primary author, Sam Tabry, and other authors, including Dr. Snehal Patel, Neville, and myself. And I'll give brief introductions of all of these people as we move forward. So we'll then have a second round of comments and responses, and followed by Q&A with the audience. Some of you already submitted questions, and we really appreciate that. You should feel free to submit your questions as panelists are talking. Some of the questions will undoubtedly be answered along the way, but we'll also preserve time, around 15 or 20 minutes at the end, to specifically address questions you might have. So let me just give you a quick word, say something about how the report came about. Last spring, Dr. Snehal Patel, who is assistant professor in the Department of Internal Medicine at Dell and cares for many of the patients hospitalized with COVID-19, and he's also affiliated faculty of the Rapoport Center. He informed us of some preliminary data that he and colleagues were finding at Dell Seton and other hospitals in the area. Not only were a high percentage of the hospitalized patients Latinx, many monolingual Spanish speakers, but as Snehal and his colleagues began to look at the available occupation data, they saw that a large percentage of those patients, 40% even at Dell Seton early on, were in construction. So we began to talk about the need to find out more about why that was the case. And actually, one of the first things we did was we wrote a grant to the Russell Sage Foundation together for funding to investigate the disproportionate hospitalizations of Latinx construction workers in the Austin region. And we didn't get that funding, but as these funding proposals often do, it led to our commitment to do the work anyway and to find another way to do it. So we began to pursue the project more deeply through a collaborative project over the summer that we did with faculty and students, not just at UT, but from Harvard and Northeastern, that was focused on the political, economic, and legal drivers of a number of identified, what were then called COVID-19 hotspots around the country, and even one in the United Arab Emirates. Sam Tabry, a PhD student in urban planning at the Harvard Graduate School of Design, was one of those students. He also has a master's degree in Latin American Studies and Community and Regional Planning from UT. So he was a perfect fit and really took on the major authorship of the report. So Neville will give us some of the findings of the report.
Thank you, Karen. I'm going to try and give you a brief summary of the report. I'm probably going to do a little bit of violence to it as I do it because it's a long and detailed report, but here goes. Let's start with the construction industry. Analyses of the construction industry in Texas and by extension Austin, as well as comparative analysis of construction industry configurations globally, consistently indicate key structural factors in the sector that participate in the production of general conditions of worker vulnerability. Such factors include: 1, wide reliance on subcontractors and the challenge of regulating safety across dispersed small-scale work sites. 2, the prevalence of a US model of low investment in worker skills and safety training, resulting in high turnover due to lack of sustainable career paths, as well as injury and burnout. 3, the general industry posture of deferring safety net costs onto society at large. And 4, the cutting of labor costs to enhance profit. So we're trying to get it like, okay, this was the situation before and ongoing. So the central question of the report concerns the political, economic, and legal structural drivers of unequal risk and precarity that contributed to COVID-19 Latinx construction worker vulnerability during the pandemic. And I think one of the things we learned is that COVID is not an equalizer. It's kind of a revealer, but what it really is the great exacerbator. The disproportionate impact of the pandemic is a consequence of a series of pre-existing inequalities and the vulnerabilities that they systematically produce. The report establishes how the COVID-19 pandemic is making the structural and social determinants of health starkly visible. Okay, now in terms of these legal, political, and economic structural drivers, we isolated 4 main ones. And of course, they all work in concert. In the Austin context, 1, preemption of local government by the state. The Texas governor's reversal of city and county stay-at-home orders for many construction workers in Austin was the trigger for the activation of the precarity in terms of preemption here. The making all construction work essential exacerbated state preemption of local government attempts, prior local government attempts to mandate minimum wage and sick leave, provide affordable housing policy tools, and craft sensitive immigration policies. State preemption laws help yield cumulative, and I think these things work cumulatively, social and economic effects that compound low-income Latinx worker precarity in the Austin region. 2, immigration law and anti-immigrant climate. Immigration law policy and enforcement combine to complicate the ability and willingness of Latinx workers to seek testing, medical care, and emergency relief support. I've taken most of this from the self-plagiarized, etc., from the executive summary, which I imagine if you've read any, that would have been what you've read. Okay. 3, housing conditions and household level economic security are negatively affected by rising housing costs in the region, amidst displacement and development pressure, creating conditions that potentially compel multiple members of a household to work outside of the home, even during the pandemic. If workers are displaced to jurisdictions outside the city of Austin or Travis County, they may have less access to local public aid and could face greater risk of immigration enforcement. 4, and this is where it gets tricky. Urban regional growth politics and law in the Austin region are structured in ways that consistently subsidize corporate interests at the expense of low-income workers and artificially truncate analysis of how worker vulnerability is entangled with the claims of local growth boosters, namely around the region's low cost of living and quote-unquote progressive identity. And here we're in the paradox of the blue city in a red state, where actually the business-friendly bits of the red state are actually feeding the growth of the blue city. Early interview responses suggest mixed worker perspectives on growth and economic opportunity. Okay, the frame of the social/structural determinants of health is implicit in all these economic, legal, and political drivers, and provides the impetus for this ongoing research. Our main recommendation is that the costs and benefits of growth be more equally shared in a post-pandemic world. Back to you, Karen. Thank you. Karen, you're muted.
Thank you. So we've asked our respondents to engage the findings of the report from a variety of perspectives. Those perspectives would include accelerating urban growth and its impact on social determinants of health and worker advocacy and organizing. Now, I could spend the entire time telling you about our remarkable respondents, but in order to make sure that you get to hear from them, I'll just give you a few highlights of their biographies, and full biographies are available on the website. And I think that Sarah's going to put the link in the chat for people who want to see them now. The first respondent will be Greg Abbott, who is an Austin City Council member representing District 4, and he's been doing that since 2016. He's also a movement organizer. Prior to serving on the council, he worked at the Workers' Defense Project. As a council member, he's championed many of the causes the report is concerned with, particularly around worker wages and benefits, housing, and corporate subsidies. And he's behind much of the city policy, definitely championing much of the city policy that has unfortunately been preempted, as Neville just talked about. Jewel Mullen is an internist, epidemiologist, public health physician leader, and the former principal deputy assistant secretary for health in the U.S. Department of Health and Human Services. In addition to being the Associate Dean for Health Equity at Dell Medical, she's also an associate professor in population health and internal medicine, and senior consultant for Ascension Seton to help meet health equity goals. She's on frontline conversations on health equity in the Austin area. Emily Tim is co-founder and co-executive director of the Worker Defense Project, which is one of the leading advocacy organizations in Texas, with a membership of thousands and has offices in Houston, Dallas, and Austin, although she's located here in Austin. She has also, over the last 15 years, been involved in successful advocacy, and then that the report is focused on, as well as some unsuccessful advocacy, largely because of state preemption, which will be a continuing theme. She also, as a researcher, has been involved in many of the reports on which we relied in our own report. So with those introductions and giving you a sense of where folks are likely to make their interventions, but it will be a surprise, I'll ask the first question of each of the panelists, and we'll go in the order I just introduced them. What are some of the key themes that emerged for you in the report? So we'll start with Councilmember Kassar.
Thanks, Karen. I mean, the core themes of the report to me are so many of the core themes of what's going on with us as a city and as a country, in that race and class really have determined the outcomes for so many people in this pandemic. My constituents, are overwhelmingly, my district is the lowest income district in the city. It has more construction workers in it than any other part of town. My district here in North Central, Northeast Austin, and Southeast are the two most Latino parts of the city, and mine is the most immigrant. And overwhelmingly, what we heard and saw from constituents was que vamos a trabajar porque tenemos que trabajar. Folks are going to go to work because there's no other option. And that so many of our local powers, even in a city that tries to pride itself on being progressive and then sometimes in fits and starts tries to act that way, we've had our ability to resource people and to provide services to communities so hemmed in by the state. And then we didn't see the response from the state and federal government who has hemmed us in to address the challenge. So people, we heard a lot about how people at the beginning of the pandemic wanted to get their check from the federal government, but that immigrants were cut out of that check, and immigrants overwhelmingly are in the construction workforce. You didn't hear as much about, because we have kind of internalized, too many of us internalized the fact that undocumented folks and many immigrants don't get unemployment insurance either. And so while we had to do the right thing and attempt to temporarily lock down big segments of the construction industry here locally, while we got our hospital capacity ready and some of our public health measures ready, it still put folks of color, especially immigrants, especially undocumented folks in the construction industry, in an impossible bind, because there is no social safety net for them, hardly at all. So even when we scraped up a few local dollars that we could give out as immediate relief that wouldn't exclude undocumented construction workers, there's only so much a local government could do. And so we have done more than I ever believed we could. We're still trying to come up with the kinds of protections that people deserve. But in so many ways, the disaster was coming and has been with us for so long. And people in some ways had gotten used to the idea that, well, undocumented folks can't vote. They have the right to vote denied to them, the right to unemployment insurance denied to them, the level of just baseline protections that are already so low in our country and our community, or are so much lower for so many folks in construction. And so this was sort of bound to happen. And that's horrible to say, and then when you struggle to figure out what to do, in so many ways, those are things we should have been doing every day for years coming up to this moment. That doesn't excuse any mistakes since then. And it's still incumbent on us to do everything we can, which we'll talk about some of the things that we've done, which I think some of them have been very impressive and important. So many of them by Workers Defense, who's here on the panel, but also it was a disaster in the making for people that are underpaid, politically disenfranchised, and not given the basic rights they deserve. And so people that were declared essential workers had not been treated as such, had not been given essential protections. And so this is where we are. To not just leave it on a gloomy note, though, I mean, I do think that this community in many ways has rallied and come together. Though the impact has been very disparate on communities of color, we still do have the lowest rate of death and hospitalization of any of the big cities in Texas. We still do have the lowest level of eviction filings by far in Texas. Houston has 25 times more evictions, Fort Worth about 15 times more evictions filed. And I credit a lot of that to the work of community leaders, of people advocating for our communities of color, some good decisions by local government, but then also of everyday people stepping up to take care of one another. And it really shouldn't have to come down to sometimes individual people making those choices. But I do think that despite the horrible and tragic impact on communities of color, those same communities have also stepped up and kept this city safer than many other cities have endured. And I hope that we can stay on that path.
Great, thank you. I think that's a terrific segue to Dr. Jewel Mullen.
Thank you. There's going to be a lot of alignment, agreement, and reinforcement of one another's points, I think. And so I know I'm Dr. Jewel Mullen, and what you hear me say reflects the way I practice my medicine and public health now, which means before I get to Austin, I just want to take a moment and say, I'm also thinking about Gainesville, Georgia, and the people who died there in the poultry industry. None of whom do I know, but just knowing what I know about who's worked in all of those plants in the country state that's the largest poultry producer, I think there are other stories to be told that mirror what we're talking about now. And even as I've read about Gainesville and how some employers offered their workers maybe $400 or $500 that they would get if they came to work every day for 3 months, it makes me think about the kinds of incentives that are the disincentives to really do what's right for people. And so now I'll come to Austin and say how I hope that this report really reflects a new way that we can actually address getting to the necessary changes that we need here. I've only been working in Austin for about 2.5 years, and I have tremendous respect for all that gets done. And I understand how much more we really have to go deep, deep into sort of the roots where policies are made, and be able to have conversations that change things, and appreciate that if we're doing them on behalf of people, they ought not all be derailed because somebody calls them political when they actually have something to do with people's health and well-being. And I know as a doctor that we're not going to do that through healthcare solutions when so much of what we're talking about happens way before and after people get sick, and contributes to their inability to even fully recover after they do. And so as we have this conversation around construction, I also think about how much I learned just reading The Color of Law, Richard Rothstein's book, that really also made me, and I mention it because for people who are still asking themselves, how could this have happened? I don't imagine how you could read that book and not really understand the importance of this report and what it's trying to uncover when we really get to structural inequality and the importance of understanding how deeply embedded policies are and how much they get in the way of really being able to make lasting change for people's well-being. So with that, there are a few things that I've thought about, and just pulling something out from the report. I remember from page 5, I had to write it down. There was a suggestion that corporate players needed to bear a bigger share of the costs for solutions. My silly little self-promotion isn't about me. It's actually about the DelMed webpage, where recently a few of us leaders had written some things about what should happen going forward in Austin. And what I reflected on was that as people are waiting to see us get to some kind of herd immunity through the pandemic, that it was time for us to look for herd accountability in the city of Austin. Herd accountability across our business sectors, who really play such a role in deciding what kind of workplaces they configure for people, given the way our policies actually allow them to behave. And that accountability then really does bring them more into being part of the solutions and gets people away from thinking, well, maybe it's not really just about the workplace, which really I want to mention, because for individuals who wouldn't necessarily be available for something like workman's compensation, it's extra difficult when you're not, say, example, defined as essential as a non-medical person to prove that your work actually contributed to your illness. And for individuals whose life before they get to work, the way they get to work, what happens after they get to work, and how they are constrained in living situations sometimes impact whether or not they're going to get sick, it makes it a lot easier for many people to absolve themselves of any kind of responsibility or accountability for illness. So having these conversations that really layer on the different contributors that you've mentioned in this report are really key. The other thing that I appreciate is that the starting point for this report was really, based on who showed up sick, which makes me want to, and I know we're not talking about future, remind us that we don't have very good data in Texas. According to the Atlantic COVID Tracking Project, we still only report race and ethnicity on 3% of the cases that are reported to the state. So I also want to use this opportunity to ask ourselves what else we should think about, who else we should think about, what other sectors we should be thinking about. And I know we're going to talk some about social determinants and other things later, so I'll stop there. But I have learned that in the same way that I've needed to know history to be effective at my job, I've also needed to partner with lawyers. So Snehal, Dr. Patel, and all of my legal colleagues here, thank you so much for demonstrating for all of us what the impact of that can be.
Thank you so much, Jewel. And thank you for mentioning Gainesville, Georgia. I've been thinking about it a lot, obviously, but also just want to mention that that was one of the hotspots that we looked at over the summer. So there's a lot of great material on the same website where this report is. You have to go back one, I guess, on the website, but that does talk about Gainesville. And maybe Sarah, you can even put that up in the chat, not to distract people from this conversation, but I mean, my reaction was, unfortunately, the report was on point in terms of identifying so many of the ways in which workers were already expendable there. I'll turn it to Emily now.
Okay, thank you. Good afternoon. I really appreciate the opportunity to join this panel, and I'm grateful for the chance to get to speak with the distinguished panelists and authors of the report. So thanks so much for having me. So I think the thing that really stood out to me from this report were that it's providing a much needed academic study linking politics and the actions of political actors to health outcomes, and how those political decisions that are made at the state level or the local level, how those actually have direct real life impacts on people's health and well-being. And I feel like that's something that's not often, we talk about health in medical terms, and we talk about health sometimes even in social terms, but not usually in political terms. And there is nothing that is more at the core of what makes a community healthy than the power it has and the political power it has in the society in which it exists. And I think that the study really draws that out in a really profound way. So from our perspective at Workers' Defense, one key takeaway is that construction workers and immigrant construction workers and the construction industry really had some pre-existing conditions going into this pandemic. That the construction industry in Texas has been characterized by low wages, lack of job security, few benefits. That these are issues that long preceded the pandemic. That workers often don't have access to workers' compensation coverage. That they have no health insurance and don't have regular access to medical services because they don't have health insurance through their jobs, and that they don't have access to paid sick leave. And these are all policies and topics and issues that Workers' Defense has advocated around for over a decade. And you also just look at the workplace safety. The construction industry was struggling to keep workers safe, and Texas has where 1 in 5 workers was being injured on the job prior to the pandemic. And so we see a workforce and a community that even in healthy times was really one layoff away or one worksite accident away from economic ruin, because they don't have savings, because you don't have that ability to fall back on safety nets in the way that other sectors do. And so that's a real structural failing of the industry in terms of taking care of workers. And so that's why when we saw these just appalling numbers of workers becoming sick at much higher levels and hospitalized at 5 times the rate of workers in other sectors, that it really goes back to that root of what were the conditions that were already present in the industry. And so that's something that we as an organization think that we know that this is something that's now playing out whereas we have seen again and again our members who have experienced a workplace accident or workplace injury, how that is just devastating to their family, that now this is happening on a society-wide level where workers were becoming sick, or if they were out of work, their families were facing economic disasters and really not having those public safety nets to fall back on. So we've really seen that this is where our system has been failing systematically, and the pandemic just exacerbated that and showed what it looked like when on a society-wide level, an entire group of workers didn't have access to those benefits and protections. We know that one of the key problems, and where this comes back to politics, is sort of the push and pull that the report described between local efforts to try to keep construction workers safe and to shut down work sites, even if temporarily, in order to contain and to prevent the spread of disease. And then the pull of Governor Abbott reopening those work sites, and that those were very much political decisions that had real life consequences on the lives of workers and the health of workers. We also saw that there was also political positioning around wearing masks, and that at the same time that construction workers were declared essential workers and work sites were opened again, that there were no essential protections being provided for those workers. And so those are definitely just key takeaways that illustrate sort of the underlying problem. And what that really says in terms of like, where do we go from here, right? Where do we go with that? Is I do think that there's a useful frame that's emerged out of this moment and out of this work around essential, that these workers are essential, that we're recognizing the contributions and that just how critical the contributions are to our community from workers, including construction workers. And we like to think of it as, we like to think of them as always essential. They always were essential before this, and they will be essential going forward. And how do we harness this additional awareness and the awareness of the how these political decisions are impacting workers to now move for the longer term structural changes that we need to keep workers safe and to prevent from this sort of widespread disaster if there were to be a pandemic again in the future, or other type of crisis that would face this workforce. So I'll stop there, and just to emphasize again that I think that what's key here is that a community that is being attacked or criminalized, like the construction workforce, which is primarily which is made up of about 50% of a immigrant workforce and undocumented workforce, is also facing these extra pressures that I think create further barriers to health. So not only the specific actions around COVID-19 response from our government, but also the larger political climate of anti-immigrant hostility and criminalization of immigrant communities that threw up additional barriers to healthy outcomes for this workforce. I'll stop there.
Great. Thank you, Emily. And just in case people haven't fully read the report, I want to identify the work that the Workers' Defense did in helping us interview workers, which made the report we weren't able to interview as many as we had hoped in the end, and hope to continue to interview them. But I think it was so essential to many of the insights we gained, especially around what you and Greg have focused on in terms of the economic hardship that people have and the very few alternatives. So with that, I will ask maybe Sam, if you want to just have a short response to the response, and then hear from Snehal for a moment too.
Yeah, absolutely. One, thank you to all the other panelists for being here today. I mean, these responses have been incredibly illuminating, and we really appreciate you all taking the time to engage with the work we were trying to produce here and thinking about how it links to these larger conversations. I think it's 3 points on my list here, but just sort of quick things that came up in the response that resonated with how I was thinking about the report, and I'm interested in seeing if we can continue taking forward, would be first, the language that Councilmember Kassar used in terms of what we've gotten used to, and how part of the conversation that we were hoping to contribute to, because we understand that it's well predating the pandemic, and then also sort of the work we were trying to do here, is thinking about, can the moment that we're in be used in ways that challenge sort of dominant logics around how we think about how things should happen or how things should be in terms of politics, and growth dynamics, and what we understand to be business as usual versus what we might like them to be in an alternative future. And not only thinking in terms of sort of immediate policy wins that we could possibly target, which is absolutely incredibly important work, but also trying to sort of invoke deeper, or not necessarily deeper, but sort of a different view of some of these things we've gotten used to, as Councilmember Kassar was saying, not only in terms of sort of what protections are not provided to undocumented immigrants, but also these questions of what it means to talk about the politics of Austin, or the politics of the Austin region, or the politics of the state of Texas. And so maybe here I can pivot to that question of politics, which is something that I think both Dr. Mullen and Emily spoke really eloquently about, in terms of suggesting that that's actually at the core of what we're talking about. It's not a peripheral or sort of an alternative view. It's at the center of what the predicament that workers find themselves in, is this question of politics. And so if we have a conversation about logics and what we've gotten used to in politics, one thing that I'm interested in further exploring and hearing from the other panelists about is thinking about how we untangle, it's not just the city of Austin and its politics in terms of an official, what actions are being taken. It's not just about the community advocates and the community organizing internal to Austin or Travis County that both Emily and Councilmember Kassar have highlighted. It's not just about the state of Texas, but it's about this interaction across the three, and thinking about how preemption isn't necessarily exclusively an antagonistic thing towards Austin, that Austin as a region and as a city has benefited tremendously in an economic sense from the nature of what a low cost environment relative to national markets, and what sort of a pro-business environment feels like at a local level. And so can we question what it means for local political leaders to be welcoming major corporations that are basically expressing an explicit attempt to move away from high tax regions, and what's actually being lost when we talk about low taxes versus high taxes? What are they actually saying that they're not interested in supporting by moving to a low tax region? And I think being more explicit about that is a conversation that is really interesting and could potentially move us forward in this question of logics and what we've gotten used to. And then the final thing I want to call out is just, I really appreciated Dr. Mullen's framing about stories, and then also trying to expand this beyond Austin, that multiple sort of places across the country are going to have their own sort of particular contextual brew of policies and logics that can produce precarity in these ways. And so we might be focusing on Austin here, but there might be lessons that allow us to think about sort of what could be applied elsewhere, but also what's happening elsewhere that might be relevant to how we understand what's happening in Austin. Anyway, I'll stop there, but thanks very much for the comments, and looking forward to the conversation.
Thank you. Snehal.
Yeah, thanks. Yeah, I'm really enjoying this conversation, and I'm going to try and be brief because I want to hear more from Emily and Greg and Dr. Mullen. A few things. One, I'm a practitioner. I spend the majority of my time in the hospital, and seeing patients and talking with patients and family members, and helping from the acute recovery from whatever illness has landed them in the hospital. I also see myself as an organizer, and the space that I'm situated in is within the medical school, within the hospital, and in a community of public health providers, medical providers, healthcare practitioners. And sometimes I see myself as an academic, although that's more by association than anything else. And so I want a couple of things that I wanted to pull out that that y'all said, right? Council member Greg, right? You mentioned the story of, look, what I hear all the time is I'm going to work because I have to go to work. There's not an option of not going to work. That option has not been provided to me. That option doesn't exist as it stands. I have to go to work. It's not that I want to get sick. It's not that I want my family to get sick. It's that this is the current option that exists to me. I think that's important. It's important to identify, what are the sort of current legal, political, economic policies and situations that folks have found themselves in. Number two, communities of color are organizing and have been organizing for self-sufficiency and to be able to take care of themselves throughout this pandemic and throughout history. But communities that are frequently at the greatest brunt of harm figure out ways to care for themselves, even though they're frequently, even though they're at the greatest risk for illness, disease, death. The level of organizing that happens within communities at great risk is outside of the realm of understanding sometimes of those who are pushing forward certain politics or policies. And those that are in the medical school or within the hospital who have an understanding of what's happening on the ground, what construction workers are doing to take care of their crews, themselves, their colleagues. A lot of times we don't have that really great understanding. But so I wanted to take a quick mention of that. And then Dr. Mullen, you mentioned this piece around herd accountability that y'all had written, and I haven't read that piece, but I think really thinking about, okay, where is it that we as professionals within the space of healthcare need to push forward an understanding of what accountability looks for within the larger spaces, maybe not directly within the hospital or within the clinic, to actually think about what accountability and care requires. So I appreciate all of those points, and kind of moving into maybe the next round of panel conversations. I want to throw this out there, partly because I think there's a lot of possibility and opportunity around the conversation around the social and structural drivers of health, and where that analysis can take us or where it may not take us. So I want to tell a little bit of a sort of story of the last 10 months that I've been following and hearing, that is that there was an early identification of occupational clusters, risk, hazard that was identified here locally within construction, elsewhere in meatpacking plants, certainly amongst farm workers, in a number of industries, mostly those where Latino, Black, Indigenous folks were the primary workers, and very, very vulnerable, precarious conditions. That conversation rapidly moved away, right? The public health community in some ways focused on it early on in March and April, put in place some things, and I'm talking about here in Austin, but also around the country. But then moved the conversation away towards personal behavioral decisions to help decrease risk of transmission of COVID, which I'm not opposed to. I think that's important, right? So we need to mask, we need to socially distance, we need to wash our hands, things like that, things that are dependent on personal behavior to curb the pandemic. What we moved away from, though, is understanding some of the social and structural drivers of disease and pandemic, right? We moved away from understanding occupational risk and occupational hazard as a key area that there is potential for public health and health agencies and medical providers or healthcare healthcare practitioners to play a role in terms of pushing some of the legal, economic, and political conversations in that. And so, yeah, I want to partly throw that out there because I've seen this almost abdication on the part of the healthcare community, and I'm going to use the term healthcare community very broadly, but the healthcare community during this moment of pandemic, when if we were going to speak up about the social and structural drivers of health and illness, this is the time when we haven't been able to effectively organize ourselves to do that. And so I want to throw that out there as a topic for each of us, because in some ways I would kind of want to move the conversation towards what is the future of organizing look like? What is the future of organizing amongst communities, communities disproportionately impacted by illness? What is the future of organizing amongst workers? And what is the future of organizing look like amongst healthcare folks who have a who have an interest and commitment to this, but who may not necessarily be thinking of some of these larger frames?
All right, Snehal made a nice transition to the question I'd like to ask other folks, I guess both in terms of responding. I mean, some of the questions that you just posed, we also had from some audience members. But I think the best way maybe to get this next round going is just to ask, what does each of you see as the key challenges and pathways moving forward? So we'll just go in the same order. And I'll start with you again, Councilmember Kassar.
Well, I mean, to some extent, right, we are, entirely, we are still in it, right? And so, short term, we are trying to figure out how to deal with the hand we've been dealt. And some of that is really important work on the healthcare side, public health, and in organizing and advocacy. When the governor preempted our order, shutting down some number of construction sites, we wrote emergency safety rules about distancing, hand sanitizing, mass distribution, worker check-ins before coming into work, that I think contributed significantly to slowing some of the spread in the industry. So of course we couldn't do exactly it the way that we wanted to, but we did what we could with that hand as was dealt. We passed a while back now the first paid sick time law in the American South that then actually got passed also in San Antonio and in Dallas. The state government attempted to preempt and block that law, actually did not successfully do that because of really important advocacy work. Ultimately, the courts, including in Dallas, the courts blocked the law during the pandemic, blocked those rules. But since then, there actually are some emergency paid sick time rules passed in the federal COVID bills. And so we started handing out at testing sites that whether or not you have symptoms, if you're awaiting the results of your test, you have access to these forms of federal paid sick time. So in many ways, we're still trying to come up with how to deal with the situation that we are put in, but not just give up and say, well, these forces greater than us have determined that this pandemic is going to be as bad as possible, so we can't do anything. We come up with the programs as we can. We knew that immigrants weren't getting much of the federal assistance that they needed, and so we connected directly with immigrant-led organizations and community groups and handed them unrestricted city dollars to get to their members in direct cash transfers or rental assistance or in prepaid debit cards. So we have to keep coming up with ways to make it work. On vaccination, we face the same sort of issue. Dallas County recently tried to prioritize a small subset of their vaccines for their hardest hit zip codes, and the state government threatened to cut their vaccine allocation. And so instead, what the city of Austin is trying to do is, since if we can't do that, why not partner with health clinics that serve low-income patients and work with them to really do outreach and encourage their patients to get signed up to see if we can have more equity in our vaccine distribution. So again, we have to keep on coming up with ways, given the current system that we're in, to save lives. And then longer term, and I'll let everybody talk to this point, but longer term, right, we have to change the baseline structure that we're in and the way that this has been dealt with. And there are some potentially near-term opportunities for doing so. I think it is really powerful that people are considering, as part of a COVID relief or even budget reconciliation, to give legal status to all essential workers in our country, because that is part of what got us into the place we are in. I don't think that immigration reform should be some, always stuck into being some standalone thing, because it is part of COVID recovery and COVID relief, and could actually be passed by a majority vote of the federal government. And so I think those sorts of structural changes to allow the people who have been most harmed by our politics in this public health crisis to actually have a say in their own lives and their own politics would be really powerful, along with things like DC statehood and other things that would give communities of color that have been so hard hit a direct seat at the table, is important, because we have to realize that a lot of these cleanup things I've talked about, or we're like, well, let's figure out how to help around the edge, are caused by an imbalance of political power that has to be corrected. But at the same time, we can't just be waiting for that. We have to figure out how to get fewer people deported, how to make sure people feel comfortable going to government testing sites, how to make sure that vaccine distribution websites aren't impossible to navigate without a degree in computer science, that kind of stuff that we have to do now. In some ways, as Snehal is embodying, right? We have to be practitioners of providing the direct service in healthcare now, while being organizers and aware and talking about this, so that we can change the condition longer term about the power imbalance in our state.
Great, thank you. And one of the things in the report we do try to point out, and but you've just added to it in some very nice ways, are some of the creative things that the city and county have done, notwithstanding the threat of preemption or actual preemption, whether by, the sick leave is such a awful story, because you're right to remind us that you all won at the legislature, actually, and then it was the courts. So maybe Jewel doesn't want to get to know us so well after all, or have that alliance, but I'll turn that, it's you, Jewel, to talk about some of the challenges you see ahead.
Well, you might decide I already know you more than you want me to, given some of what I'm about to say, which is all opinion and not necessarily all fact. But I'm going to try to respond and also touch on some of the points that Sam and Snehal made along the way. Starting with, how do we get anything done in the context of everything that we've said, where I believe politics can't just stop you unless you let them, is the phrase that comes to mind is making a way out of no way, which doesn't mean there's no way. It's just you have to pivot, you have to figure out something else. And that gets to something that I tell students sometimes when they've said to me, how did you manage to do this or that? Didn't it make you mad? And who on this panel hasn't been mad about some of the things that you have to deal with every day because of what other people deal with and don't have any power about? So I say, don't get mad, don't get even, get strategic. And so when then, as I think about whether or not we've gotten used to certain things, and that acculturation has influenced the way we react, part of what I say to myself is, I think it's time for people to be bolder and more action-oriented. My introduction to Austin when I started interviewing for this job was to read the Institutional Racism and Systemic Inequities report and the city, Austin Public Health's Community Health Improvement Plan, both of which are fine, and both of which are fine. And they're very processy. And I contend that whether or not you're an organizer or think you're a policymaker, as long as you're pushing process without any real outcome and impact and metrics and accountability built in, people will let you keep doing that forever because you're not really changing things. And so there's a way, I think, for all of us to figure out how to individually and collectively be bolder and drive more action in ways that also can have some short, intermediate, and long-term impact. And even if we start saying things like, if you want to call somebody an essential worker, follow that with "and equally important," then we get to say, we didn't just decide somebody is essential because they're essential to our agenda alone. Because right now, that's how we really think, we're docs, are we essential workers or whatever. In a certain way, you can sort of declare somebody's essential because you need them in your toolkit to drive your economy or something else. But it doesn't necessarily mean they come with anything else that shows that you really value them. So to build some equity principles along the way is a way to do that. And Snehal's point about the public health system, well, anybody who fears that the public health system is set up to take care of poor people is going to then say, well, we'll give them as much as we're giving poor people. And so that's part of what we have, because we have not invested in well-being for everyone anyway. So if the health ecosystem really needs to include everybody who has an impact on health, including employers, including hospitals, but maybe in a way other than that, they're just their direct medical care. There are a few things that could happen. Okay, we have equally important essential workers in industries that want to work. Maybe what California did with the equity assessments that needed to factor into whether or not California could move from one stage to another stage of reopening, only after people met certain criteria, could be factored in a way that really looks to uphold worker safety and well-being in construction, in long-term care facilities, and maybe those kinds of criteria could get built into who gets to be a hub for vaccination distribution. I'll stop there.
All right. Emily, do you want to add even more challenges for the future and some ideas too?
Well, I mean, I think we all have a pretty clear idea what the challenges are. I think some of the challenges for the future are the same challenges that we've been talking about from the past and that got us in this position in the first place. And I think that it will continue to be a challenge for us to fight back and for our members to push back against sort of the political environment in which they're in, that we need the state to act immediately to put in place safety standards like enforcing physical distancing, requiring employers to provide basic PPE, offer paid sick leave. These are basic things that we're asking for, but could really make a big difference in the conditions that workers face and the safety and their ability to keep themselves safe on the job. And so I think that we also know that pushing back against the political attacks that target working people, that target immigrant families. We know the passage of anti-immigrant laws like SB4 has created these environments where this is really challenging. So we've mentioned some of these challenges. I am interested to speak to also, and I really appreciate the point made by Dr. Patel about about how communities of color are organizing, how workers are organizing. And that's something that I think that became really clear and apparent to our organization and to our members when the pandemic first started, that we weren't sure where help was going to come from, if help was going to come from anywhere. And so there was an immediate decision by our members to sort of take a collective care approach, to actually set up a mutual aid fund and that would help communities through this crisis, and to really put that out there and through our own networks to try to provide support and immediate needs of our community. We heard stories of, so first of all, an influx of donations and money coming in to support workers who were being left out of the CARES Act. And that was due to community organizing and worker members sharing out those resources and that information. But there also were members stepping up and supporting each other. When one of the family members became sick, that like people were dropping off meals and dropping off food at each other's houses. Like there was a community that came together around responding to the crisis that our community faced. And, you know, we need at scale solutions to a global pandemic. But that I think it's important to recognize that those come when there is a community that's organizing and not just doing that mutual aid and collective care, but also demanding that those resources are directed to the community and that they're included and that they're taken into account. And that's something that when I look at the last 9 months, almost a year now of this situation, that like our members never stopped organizing. The community never stopped organizing. The second this came together, this began, we came together, now not in person like we're used to, but we learned new technologies and we came online and have like greater participation and like broke like new membership. We're a membership-based organization, broke membership records as people came to the organization initially out of need, but stayed because we were fighting for something together to make a difference and to like ensure that these sorts of things wouldn't happen again. And so it's about access to a safety net, access to a community that's not actually being provided in other places, but that is really a way for us to then organize for more systemic approaches, for taking on the structural problems, for pushing back and asking for eviction delays, which City of Austin like really stepped up and has prevented widespread evictions for many of our folks. Allocating additional city resources where state and federal assistance completely failed to provide for essential workers. And our members are right now ready to organize and fight for the path for immigration reform. And I think Greg alluded to it, but like this idea that like we are essential workers, that like that we always were, that there is this recognition of that value, that yes, it's a value that suddenly the society is seeing as to themselves, but that it's always been there. And that as such, we really deserve to have that like recognition and that pathway through the next COVID relief bill. So I just really see the ways that community is organizing and continuing to come together around really visionary demands and to take on more than just basic needs, to say like, how are we actually demanding that there are real changes in the protections afforded to low-wage workers? How are we expanding access to healthcare? How are we providing for paid sick leave? Those are all things that I think are going to be a key piece of the way forward, and doing that at both continuing to advocate for those things at the local level, but also the state and federal. And you know, we'll be continuing to make sure that workers really are the ones leading those conversations, and that those experiences that people have shared during the pandemic are driving those demands.
Fabulous. Sam, do you want to jump in for a second?
I was actually wondering if you or Neville, as sort of additional report authors, have thoughts as how the conversation's gone so far.
Neville always has thoughts. Do you want to say something? You have to unmute.
I mean, I'm kind of blown away by the sort of synergies between people's various perspectives and the sort of the okay, I'm an academic, so I speak pompous professor speak, and then I will try to dial it back. I mean, the sort of multidisciplinary kinds of knowledges that need to be brought to bear on this problem, and also the different timescales of possible action. And somehow it feels sometimes it just feels like we're too late. Like actually for this to have been prevented, there needed to be a lot of things happening differently in the way that industry is organized, in the way we organize politics. But then, I mean, I was very cheered by Emily's kind of cogent optimism in the face of crisis. And actually, but I also don't want to use the resilience of people suffering as an alibi for not making the structural changes. So I think that the challenge is to put the analysis alongside the practice, and not to get overwhelmed by the fact that actually a hell of a lot of things have to be happening with a hell of a lot of people all the time and now. So I really just want to thank our respondents for, not just intelligent analysis, but practical suggestions, and also, just for performing the kind of courage that it takes to have hope in these very, very difficult times. So thank you.
Jewel, do you want to respond?
Yeah, I want to say something to the not at all pompous academic. From the non-academic academic who doesn't want to sound pompous. Look, this is a research academic environment. We talked about organizing, we talked about community members. As we know, policymakers rely on academic research to craft their policy. I chair a national advisory committee for a grant program called Policies for Action. And I'm a broken record, even outside of that committee, that we can't just do research for research's sake. Can I say, there are a whole bunch of people who do great work that's interesting, but at the end of the day, their findings might not necessarily be of value to push forward what really needs to happen to support the bold kind of policy actions that people ask for. And having been a state and federal health official, I know how often I have talked to legislators who say, we don't have enough evidence yet. Well, that's always nice to say when you don't pay attention to the evidence that's there. But if we undershoot in what we're trying to study, for example, if I saw another grant proposal that, wanted to look at sort of moving somebody's minimum wage from $8 to $9 an hour, would say, like, why try to tell anybody that would be okay when you can't live on $9 an hour? So that's just, a loose example, but it's also important now to push in the academic side to know that if somebody's going to pay for research to be done, that it ought to really be able to say what the impact might be. At the same time, that it will be important for those who decide something is not worthy of funding, and I have no idea what decision-making was going on with the foundation that didn't originally fund you guys, to also be honest with themselves about whether or not there's bias in what they're willing to support to generate more evidence where we need some. That's all.
Thank you. A point I want to, or an observation to throw out, and then I want to move into some of the questions from the audience that get to the themes we're discussing. But as I was rereading the report this morning, I was thinking how differently we would or wouldn't have written it if we had a new administration. And I think it's important that we don't rewrite it until we see what happens. It's great to hear and to know about some of what's being done at the federal level. And I think it is important, to see that we won't have all of the obstacles that we had, even if we'll continue to have some of them at the state level. But one of the things that I really appreciated about each of your comments was how they were both so local and so national at the same time. And thinking about solidarity with folks elsewhere, and also learning from people who have similar struggles. And that's gonna, one idea that we had talked about in terms of a blue city and a red state, well, there are a lot of those, but the answer's not gonna be the same for everyone. And obviously, we have to be very attuned to the very, very local issues. But I think that coming back to the community-based responses is really taking us there, but with an eye at the various levels. So maybe I'll go back to, we have a question from Heath Prince at the LBJ School and the Ray Marshall Center, which goes back to one of, actually, I love that it was Jules' observation from the report on thinking about, well, the herd responsibility. And also Sam talked about it a bit, but he says Texas, and he's written a report on this too, but Texas doles out approximately $1.8 billion in corporate subsidies per year, with not a great deal to show for it in terms of employment or benefits for workers. What roles, and that's a Texas number, what roles do the panelists see subsidies playing in exacerbating inequality? Can they be used productively by tying them to education and training that would enable workers to gain the skills needed to take advantage of the jobs supposedly created by industry growth attraction, given that new jobs created by subsidies disproportionately go toward those with post-secondary education, or are they destined to be simply corporate giveaways? There's a long question and not a leading one at all. Anyone want to take a stab at that?
I can speak briefly to this. So as Dr. Prince knows, Workers' Defense this is something that we've really paid a lot of attention to, and feel very strongly that, like, it's true, many of the subsidies go to companies that are going to provide jobs for people with a post-secondary education. But a lot of times those developments there's a piece of construction. Something's going to be built for the new company. Something's going to be, there's going to be other types of jobs that provide ongoing operations and maintenance and support for a new facility, if whatever the business is that the subsidy is being provided for. And I think it's really important for local governments, whether county or city, to look at how if public tax dollars are going to be used, that they're really being used to create good jobs that address these structural failings that we've identified in certain sectors. So if there's going to be construction jobs, or if there's going to be ongoing janitorial jobs, in addition to whatever the long-term jobs are, that those have to be part of the tax incentive negotiation. They have to be part of the standards and the expectations, and they have to have rigorous enforcement and oversight to make sure that they're met, in order to really be, if public dollars are going to go to a private corporate entity, then they really need to be creating good jobs that are alleviating poverty in our community, and for moving people out of poverty in all types of sectors with all educational backgrounds. So sort of start to finish for the whole life of the project. So I think there's ways to do it. We've been working and advocating to get those sorts of standards attached to particular projects receiving tax subsidies over the years, and have seen some success with that in some cases, and then in some cases where it's been hard to get those to stick, and to in particular for the lower wage jobs. So that's, and I know other folks on the panel have also done work around that, and around shifting those, as I think it's important to sort of establish what the values of the community are in terms of what those jobs need to look like, and make those just like the baseline expectation when public dollars are going to be used for a corporate entity like that.
Greg, I'm assuming you have something to say about this since you've been involved in.
Sure. Something I was involved in, both working for Emily and now being advocated to and pushed by Workers' Defense. But ideally, there's some sort of ban on what you saw from Amazon, where you put cities in this Hunger Games against one another for the jobs that community members need and want, and you level the playing field that way. Now that you're in a situation without that, then people are caught trying to figure out how it is that they create the good jobs when we are preempted from saying, because ideally also we say, no, we're setting a $15 an hour minimum wage statewide and make it 17 or 18 in Austin because it's more expensive, but we're also barred from doing that. So it puts cities in this very challenging position. But generally, I found that the best way to, most of the folks that say that they want to stay in Austin is because there's public investments in the public rather than in any individual private industry or company, because having a great community college system or great parks or great small businesses and good jobs is more of a economic driver and can lead to the equity goals that you want. Lately, there have been, I think, in 6 years, maybe one of these sorts of deals that has happened in Austin proper and a few out in the county. But the much bigger subsidy that we see talked a lot about right now, as we get to more remote work and companies are saying they're leaving the coasts, is the lack of taxes on income, on high incomes, and on other forms of wealth, because there's like this constant subsidy happening in our states on that isn't as flashy and isn't in a special fund that is given out at any given point. And so there's also just this massive subsidy that is regularly sort of being doled out when we don't have more progressive forms of revenue or taxation. And that's kind of one of the unspoken scandals that, I see happening here all the time.
Can't hear you, Karen.
You knew I was going to call on you, though. So I was wondering if you wanted to say something maybe about the first order and second order of worker protections that you talk about, because I think that's really your part of the report, one of them that was really helpful.
I think both Emily's and Greg's comments touch on this really well, in the sense that one of the questions we wanted to raise was this notion of absolutely first order worker vulnerability protections are incredibly important. And that speaks to everything about living wages on the job site and for contractors and for people who will be eventually employed there, and other community benefits agreements. But this second order effect and the third order effect of worker vulnerability, I think it's to what Greg was speaking of in terms of sort of this more chronic subsidy that should be scandalous, but isn't, in the way we talk about low tax statewide environments or low regulatory statewide environments. And thinking about that the decision of a major company to move to a given area is going to generate sort of an increment of larger growth that is well beyond the bounds of the site that corporation is going to occupy. It's going to generate new demand for housing. It's going to generate new demand for services. And so how do we talk about the wages that the people building those houses and those new office spaces, independent of the site that the corporation is going to, are protected and have access to living wages as well? Or the people who are going to be working in the dry cleaners, in the restaurants, in all of the basic service industries that sort of prop up an urban regional economy, how are they protected as part of this larger conversation of urban regional growth? And that's, I guess, getting back to sort of the commentary I was trying to introduce earlier around what does it mean to name specifically sort of the scandal, as Councilmember Kassar put it, behind a company. I mean, these aren't his words, these are mine, but that decides to move here for low tax reasons, or that isn't put off by an incredibly antagonistic immigration enforcement climate, that thinks that that's okay and is in line with their company values. I think those are the questions that if we could ask more directly, that is a complement to these other conversations that we're having, which in some ways I realize doesn't respond to the immediate needs that so many people are working on, including the people on this panel. And so I guess I don't see it as an either or, but sort of as an ecosystem question of having these questions and conversations at multiple levels simultaneously across the board, which obviously people are. And I think that's a really encouraging sign.
Jewel.
I wholeheartely agree. And I think there's another opportunity to keep a broad lens, because as thinking about companies coming in and how friendly the environment is, the people that they bring with them are also going to be happy to come into environments where zoning keeps them from having to live any place other than where they want to with the people that they want to live with. So it would be really important to have like multiple efforts, like simultaneously, because of the other deep structural issues. I told you I read The Color of Law, but in all seriousness, people can be paid what seems fairly and still not be able to live here, or live well because the prices continue to go up. So, and that gets back to even when I, was talking about, so whatever is going to come out of the city of Austin and saying we're really undoing structural inequality, it can't just be nice conversations. And I'm not trying to minimize the really important work that's been done, but it's time to drive in a different kind of way, I think. And I'm not even an organizer.
All right, well, I will use that as a segue into an organizing question. So we've had a lot of discussion about organizing and at the community and level in particular. There are 3 questions that are about unions and the extent to which labor unions can work with low-income workers and how. So I'll just open it up with that and see. I mean, I just would say some of them are about how can we help. So there's one specifically to workers' defense. What can unions with the building trades do to help organizations such as workers' defense? And already that kind of has in it maybe a sense that the using unions to organize the workers themselves is not as easy.
I mean, I think that labor unions play a critically important role in this whole conversation. And I think that labor unions have been one of the ways that are successful at creating and raising standards in sectors where otherwise, which unfortunately are otherwise dominated by sort of low wages, lack of benefits. And, I think that there's that piece of like kind of showing what good jobs can look like that labor unions create. I think the same individual also asked a question about health insurance and like what percentage of workers who aren't union workers have access to health insurance. And I just have a statewide number that 78% of workers from a survey that we did back in 2013 with the University of Texas, that 78% of workers don't have access to health insurance. And I don't have that broken out by union or non-union, but considering that most union workers do have health insurance, that's most of the rest of the workforce that doesn't. And so I think that there's like an important role of like showing the way forward and the way that jobs can work and that employers can be good, really good employers and can take care of their workforce is a key piece of figuring out how to do that. And then also recognizing that that we're all interested in raising conditions and improving conditions for workers broadly in the construction industry, and that there's tons of opportunities to do that, whether or not it's something that's going to actually impact individual union members who may already have decent conditions, but that it really does rising tide lifts all boats, like that sort of idea that that raising the bar in the construction industry is going to actually have a benefit for all workers from top to bottom, and from all different sectors and subsectors. And so I think unions have been really key partners in thinking about how to do that, and here in Texas, and showing the way that that construction jobs really can be good jobs.
Okay, we have 3 minutes. There are a lot of questions, which I think we've hit on a bunch of them. I really appreciate people writing them in, and they're certainly useful to us in thinking about next steps on the report and related work. Maybe we should do a lightning round and give everyone who would like to take it 30 seconds, 45 seconds to comment on anything you like. I should say one of the questions is, Jewel, when you're going to run for office. So if you decide to answer that, you can. So I'll just call on Greg. Do you want to start us off on our last round? And others should just raise your hand if you want to chime in.
Well, I saw a question from Dr. Greenberg about how it is that we measure outcomes, which is always so hard to do when you're also just triaging and trying to keep people alive and safe. But I do think that that sort of putting the facts out there for people, transparently has been something that we've been pushing our city to do so that people can more hold us accountable to the outcomes that folks want to see, to have the demographic data out there showing how many more Latinos were being hospitalized and dying, to show the inequity in vaccine distribution is an important thing to show so that we can be held to those standards. And as we've seen in crisis moments like this, if what we really focus on is how, are we getting folks that are experiencing homelessness vaccinated? Are we getting Black folks vaccinated? Are we getting non-English speakers vaccinated? If we can all come together around knowing who's going to be at greatest risk over and over, and how well we are doing there, then that the system is going to naturally try to figure out how to get people with resources what it is that they need. But if we also just really try to highlight those places where we know that there's likely already systemic failure, then that's been a good way to organize all these different local governments and advocates and actors to try to tackle the problem issue. And I think that's part of what we saw and knew about with construction from the very beginning, was that folks that are carpooling and don't have access to unemployment and are already lower income and already more crammed living conditions, that there needed to be immediate attention there. And that's part of what I think you see highlighted in the report and something important to learn on. I have to go, but I just thank you all so very much for having me.
Thank you very, very much.
So I'll just add, there are a number of studies that show that after a disaster, the most vulnerable people are the slowest to recover, and many never fully recover. So as we think about the situation, even for construction workers who might be physically healthy again, lost employment and so many other impacts on social well-being sustain for a long time and impact their families. So more to keep in mind in planning for the future.
All right, Snehal, do you want to have the closing word?
I'm not sure this is going to be a good closing, so I'll be good at closing the session, but a couple of things I wanted to highlight. One, right, we can be in the process procedural part forever, and for as long as we want to stay in the process portion, we are not a threat, right? Whoever we is, we're not a threat unless we're pushing towards action. Two, the legal, political, currently economic sort of forces and drivers that decrease, or that increase harm towards those most vulnerable are not going away, right? And frequently post-crisis strengthen in the opposite direction. And so that's happened, I think that's true at the local level and larger than that. And so part of why I say that is that, yes, there's been a shift in at the federal government level that, hopefully we'll see where this goes. But the investment at the local level in terms of where we're putting our our dollars towards public health and what that money is being used towards, as Greg Cassar was sort of pointing towards, like, are we focusing all the majority of that money towards the communities that need those resources the most, right? And are we shifting the budget in a way that actually supports more investment in public health? Are we shifting the budget in a way that supports developing a cadre of public health workers or community health workers, or sort of structure that will, in the long run, post this pandemic, create for less vulnerability, or create for greater stability or greater strengthening within communities? And so how do we at the local level sort of push legal and political drivers in that way, knowing that in the post-pandemic time there's going to be even stronger forces moving away from that? So how do we push for action there too, as we're thinking through this process?
All right, that was a closing question for us all. There's still quite a few people who stayed with us, which we very much appreciate. I just want to say it has been an honor working with you all on this report. Those of you who are involved, thinking with you about its afterlife, but more importantly, thinking about really what post-pandemic means and so many of the challenges that we've talked about as you all, both Snehal and Jewel point out, and Emily in telling us some of the history are going to remain. So we can take some of the hope, but we still have to continue to organize and act politically. So I look forward to doing that with as many of you as are willing and eager, and some of you will be doing it anyway, with or without us. So thank you again. It's been terrific to have you all here, and thanks again to the participants.